Welcome. Every single day, medical legal professionals right here in Punjab are dealing with the fallout from substance use. We see it in road accidents, in violent crime, you name it. But to really understand why these things happen, we've got to go deeper. So in this explainer, we're going to pull back the curtain and look at the science of how these substances actually hijack the brain. We'll see how that leads to addiction and, well, some really devastating long-term effects. So let's get right into it.
It really all boils down to this one big question, right? How can some simple chemical, a powder or a pill, completely rewrite the rules of your own brain? How can it change your mood, what you see, and how you act? That's what we're here to figure out.
Okay, so before we can really get how this system gets all messed up, we first need to understand how it's supposed to work in the first place. See, your brain has this absolutely brilliant, finely tuned reward system that's designed to keep you alive and motivated. At the very heart of this system is a chemical messenger called dopamine. Now, you've probably heard it called the pleasure molecule, but honestly, it's much more accurate to call it the motivation molecule. Its real job is to tell your brain, hey, whatever you just did, that was good. Let's remember to do that again.
And what this does is create this really simple, healthy feedback loop. Let's say you do something essential, like eating when you're hungry. Your brain releases a bit of dopamine, you feel good, and your brain logs that away, learning to seek out food again. It's the brain's natural engine for learning what's good for survival.
So you have this perfectly balanced natural system, right? Well, that is exactly what psychoactive substances go after. They don't invent new feelings or create new pathways in the brain. They just violently hijack the ones that are already there.
The best way to think about it is like this. These substances are chemical hackers. They get into your brain's internal communication network and they just hotwire it. They force it to do things and feel things it was never, ever designed to do on that scale. And these chemical hackers, they pretty much use two main strategies. You've got your flooders, things like cocaine or methamphetamine. They basically kick the door down and force your brain to release a massive, unnatural flood of its own chemicals. Then you've got the blockers and imposters. This includes things like opioids, from heroin to poppy husk or buki, which either trick your brain by mimicking its natural signals or jam up the works by blocking them.
Let's use a super common example, caffeine. Most of us use it, but here's the thing, it doesn't actually give you energy. What it does is it blocks the little docking stations for a chemical called adenosine, which is the signal that tells your brain, hey, we're getting tired. So you're not actually putting more fuel in the tank, you're just putting a piece of tape over the low fuel light.
And this whole chemical hijack, it always leads to the same predictable cycle. It's a universal pattern. You get the temporary high, and then you get the inevitable crash that follows.
So it all starts with the onset, and it feels like a promise, doesn't it? A sudden rush of warmth or energy or this incredible confidence. But you have to remember, it's a false promise. It's built on nothing more than a temporary manipulation of your brain's chemistry.
Then you hit the peak, that intense feeling of euphoria, that amazing calm. It's not real happiness. It's a borrowed feeling. The brain is basically running on a massive chemical loan that is completely unsustainable. And as we all know, every single loan has to be paid back.
And that repayment, that's the come down. That's the chemical debt coming due. This is that period of just total exhaustion, anxiety, maybe even deep depression. And it's not just feeling bad, that's the feeling of your brain scrambling to clean up the chemical mess and desperately trying to get back to normal.
Just look at this chart. It really shows you the insane scale of this disruption. If we take cocaine as an example, look at that peak. It's an overwhelming flood, way, way above normal. But here's the most important part. Look at the come down. The dopamine level doesn't just go back to normal, it plummets way below normal. This chemical crater is where the intense cravings live, and it's what drives the compulsive and often criminal behavior to get that feeling back. Now, when you keep forcing the brain onto this chemical roller coaster again and again, it does what it has to do to survive. It adapts. And this is the danger zone. This is where that illusion of being in control really starts to fall apart, and the process of addiction truly begins. The very first step is something called tolerance. Your brain, trying to protect itself from these constant chemical floods, basically turns down the volume. It becomes less sensitive. And the result? Well, you need more and more of the substance just to get the same feeling you got that very first time. This leads straight to dependence, which kind of has two different sides to it. First, there's physical dependence. This is especially brutal with things like opioids and alcohol, where the body literally needs the drug just to stop agonizing withdrawal symptoms. But then there's psychological dependence. This is when the brain's whole reward system gets so rewired that a person truly believes they can't feel good or even just cope with a normal day without the substance.
And this right here is the absolute crucial point. The whole motivation flips. It's no longer about chasing a high or seeking pleasure. It becomes about simply trying to escape a miserable low. The brain is so rewired that it needs the drug just to feel something that resembles normal.
And all of this rewiring, well, it comes with a massive biological price tag. The lasting damage to the brain and the body isn't just a health problem, it's the very root of the serious medico-legal consequences that we see.
Just take a look at the damage here. It's systemic. It's across the board. Chronic alcohol use just chews away at the liver and heart, and that directly erodes a person's self-control. Cocaine puts this unbelievable strain on your heart and your entire cardiovascular system. And opioids, they don't just damage organs, they fundamentally corrupt the brain's most basic ancient instincts for survival.
And you have to understand, this isn't some abstract medical issue happening in a textbook. This physical damage shows up in real-world behavior. It translates directly into impaired judgment, emotional instability, and just a chronic inability to make good, sound decisions. And here it is. This is where the science hits the street, where it shows up in the case files. That reduced judgment we talked about, that's a huge factor in road accidents. That emotional volatility, it fuels domestic violence and public fights. And that complete erosion of self-control, that leads directly to compulsive and sometimes criminal acts. The line from brain chemistry to the first information report, it's a direct one, and it is scientifically undeniable.
So if there's one thing to take away from all of this, it's this. Substance dependence is not a moral failing. It's not a weakness of character. From a scientific and a medico-legal standpoint, it is a disease. It's a neurochemical process that hijacks and physically damages the brain's most critical systems, the very systems we rely on for survival, motivation, and control.
And that leaves us with one final really critical question, especially from a medico-legal standpoint. When a chemical substance has literally rewritten the brain's most fundamental rules for survival and choice, who is really in control of that person's actions?